Oh my God. And when I told him I think I have ADHD, he said, everyone has ADHD. It was made up by Big Pharma to push stimulants on kids. Oh my God. Hey, everybody. Let's do some reaction today. I saw a thread on the Threads app that was saying, what is a red flag you've experienced with a therapist? And so I saved it. This was from 2 days ago. I figured there'd be some good responses here and I can respond to them. If you're not familiar with me, my name is Dr. Robert Duff. I'm a clinical psychologist. I focus on neuropsychology. I also do therapy, so I have some good expertise around this area. And yeah, there's a lot of shitty therapists out there. So let's see what kind of stories people have. So, first one, basically, talk too much about themselves. Basic red flag. I mean, this is not a deal breaker necessarily. It really depends on you and the therapist. There's a skill in therapy we call self disclosure, and it's exactly what it sounds like, talking about yourself. And the idea is that that's supposed to be used as a therapeutic skill, right? It's not something where therapy is not a two sided relationship. You're obviously two humans. There's going to be some reciprocity there, but one person is a client, one person is a therapist. It's inherently different than a friendship, and that's part of why it works, right? Because there's a lot of stuff wrapped up in friendships or in familial relationships, romantic relationships, and that's why those people can't be your therapist. Being a therapist on the outside is actually a good thing. And so when it becomes just a conversation where you're sharing back and forth, you're catching up on each other's lives, and it's basically just shooting the shit, that's not really therapy. Self-disclosure can be very, very powerful, though. For instance, if somebody has a therapist, right? They have a history of self-harm or alcoholism or something that the client is going through. They might ask for permission to share part of their experiences. They might say, hey, there's something that actually worked really well for me a few years ago. Do you mind if I share that? And being open about that can be a huge thing in therapy. It can really go a long way in terms of, developing that relationship, showing that the therapist gets it. But just talking about themselves for no reason, that's not really how therapy is supposed to work. I am always a fan of getting kind of like consent or buy-in before I talk about myself. Like if I say, actually, I know somebody else who has done XYZ or I have an experience, I'll usually say, so this is what the situation is. Do you mind if I talk about that? Would that be helpful to you? Before I just bleh and talk about myself. Some therapists seem like they're in therapy more for themselves than for the client. Ooh, this one's bad. She was on her phone scrolling. I have to imagine that this has gotten more common during virtual therapy. I've done virtual therapy for a long time. I did it well before COVID started because I actually did my dissertation back in the day on online therapy. And there's a lot that's great about online therapy. You can see somebody from anywhere within your state if you're in the United States, which opens up a lot more possibilities. Scheduling, things like that. There's a lot of benefits. However, anything happening down, below camera level, you can't really see. And I've heard stories of people being able to see, like, for instance, reflected in glasses, somebody scrolling on their phone. I saw one person say they saw their therapist playing a game on the screen and it is reflected in their eyes or their glasses. So that's shitty. When you're in therapy, it's normal to occasionally have, like, let's say my phone starts, going off and I need to go check to make sure that it's not an emergency. That's fine. But I don't need to be like on Instagram or talking with somebody, doom scrolling. That's just very rude. And you're not going to be present in the way that you should be for your clients if that's the case. Let's try to find something juicy here. Oh shit, this is a good one. Did couple session with an ex, and the therapist asked for his Instagram and started DMing him about non-therapy stuff. She was at least 20 years older than us. Huge red flag. Actually, that's something that could potentially be reported, like, to their licensing board. I'm not sure exactly where this took place, but you're not supposed to have like just general friendships, especially if it's going to be something that's romantic. You are not allowed to have romantic relationships with your clients. And even if you do down the line, there's a certain number of years, I'm not remembering off the top of my head, that they say you need to have at least this many years after therapy is concluded, because otherwise it's not a if there's a hierarchy in that relationship, right? There's a power dynamic at play, and there's a lot of risk of exploitation, and it's just not part of what therapy is. So that is pretty fucked up. Now, there are situations where you can have what's called a dual relationship with somebody. So, for example, I recently saw somebody for testing, which is not therapy, but I saw somebody for testing. And the family member that was bringing this person in to check on whether they might have a dementia condition was somebody that I knew from college. They were a professor of mine back then and are more of a colleague now. That's okay. As long as you acknowledge that the dual relationship is there, that you know this person on multiple fronts and it's not going to get in the way of the clinical work, that's okay. Similarly, in small towns, sometimes you're going to run into, patients or clients of yours at the store. Maybe they are going to be working at a place that you frequent. If you're in sub communities, for instance, let's say that you are a relationship therapist that works a lot with furries, right? You're going to see these people at furry conventions potentially or at local things. And this is stuff you just need to bring out into the open and work with in therapy and make sure that it's not interfering. This DMing one person in a couples therapy is just red flag central. I can't believe that happened. Okay, here's another good one. She took the video call visibly still in bed. I don't know about that one, just to start with, and spent 20 minutes telling me that her son died of an overdose. I just wanted some help with my relationship with food lady. I don't remember her name, wouldn't give it out anyway. Blah, blah, blah. Wouldn't accept any payment through insurance company despite their willingness to pay for the visit. Wow. So this person was charging cash. She took the call from in bed, which is very unprofessional unless you have a very clear setup for therapy, like in bed, right? So for instance, I've seen therapists that kind of work on a futon or a bed situation where it's a work from home deal. They have like a lap desk, there's a backdrop. It's meant to be cozy and meant to be like a professional setting. This sounds like they were just like, on their phone in bed. And again, the freaking self-disclosure thing, spending 20 minutes talking about her son dying of an overdose. That's like, more than a third of the session. And that, even if it were super relevant and helpful, would not be appropriate to spend that much time in session talking about yourself. And at the same time, it sounds like it wasn't relevant at all because this person was working on their relationship with food. So yeah, red flag central again. I should have brought a red flag to wave around. We found one. She seemed distracted during a video session. I caught a reflection on her laptop screen in her glasses. She was shopping online for clothes while I was digging deep into some trauma. See, that's just like fucked up, right? Like distractions are a normal part of the human experience, but you need to do better. You need to make sure that you're eliminating distractions when you're in a session with somebody. At any point during therapy, but especially when it's serious stuff, right? If somebody is talking about a trauma they went through, abuse that they've endured, and they see you looking at freaking, pants or dresses online, that's going to be really, really shitty for them. And that could even be potentially a big setback because somebody with trauma is typically going to avoid opening up about it because that brings about uncomfortable feelings from the trauma. And so you doing that may be proving them right in a way, whatever it is that they think about themselves, that they're not worthy of getting help, that they're trauma isn't actually trauma and that they're just blowing it out of proportion, whatever negative things they're saying to themselves, you very well may be reinforcing that with, that behavior. So be more careful and don't hide it better. Just don't fucking do it. Oof. Okay. This one. I had my psychiatrist / psychotherapist just on that note. So psychiatrist is a medical doctor. They often work with medication management, prescribing medications and things like that. Some of them also do psychotherapy. They can be able to do that. It's less common nowadays. A lot of times psychiatrists are primarily just, quick visits, medication management, things like that. And therapy professionals like LCSWs or PhDs, MSWs, they're going to be focusing more on, long-term therapy. So, some people do that. Some people do both. Others try and fail at that, which it sounds like is going on here. So I had my psychiatrist / therapist who told me that I would feel better if I was vegan and lost weight. Fuck you. Oh my God. And when I told him I think I have ADHD, he said, everyone has ADHD. It was made up by Big Pharma to push stimulants on kids. Oh my God. This person said I left, reported him to the board of ethics and never went back. Good. That's hard to do, but I'm glad you did that. Holy shit. For a psychiatrist to say everybody has ADHD and it was made up by Big Pharma to push stimulants on kids, that's so fucking backwards. Yeah, no. ADHD is a legitimate, neurological issue. You can see differences in functional brain imaging. You have a very, very clear pattern of symptoms. And if you've ever had somebody in your life that has ADHD, whether it's inattentive, hyperactive, or otherwise, and it's persisted beyond childhood, you know that it's not something that's just freaking made up. A lot of those people never go on stimulants and they manage it, through other means, which is great, but you can tell that they have ADHD. It radiates off of them. Oh my God, I would have punched this person in the face. And then same, if you would feel better if you went vegan and lost weight. Like, what is it you're talking about here, right? Like, if you're talking about specific physical health issues that could be benefited by a modification in diet, that could potentially be within the purview of a psychiatrist and medical doctor to talk about, but they would be referring you to a nutritionist or, endocrinologist or another doctor that can actually help with that. They need to shut their mouth about telling you to lose weight and be vegan. Holy shit. Okay, a couple more of these because I'm not sure if my brain could take much more. This one says, a therapist once told me that all I had to do was stop thinking about my abuser. Why are you letting them live rent-free in your mind? She said seriously. Because I had PTSD, Karen. Yeah, stop thinking about them. Stop. No more trauma. You're done. Right? Like, as if it were that easy. That's the whole fucking point of going to therapy. And if you're, getting therapy for trauma, they should know that, right? They should know that the abuse, the trauma, has made your memories of what happened to you and this person occupy a very specific place in your mind where it's active. It feels dangerous. It feels like it's happening again. And you experience things over again. It feels like it's happening to you again. That's the whole point of a traumatic reaction. And that takes care to work with. So obviously, you're not trying to let them live rent-free in your mind. If you could stop thinking about them, you would. This is why it's really important when you are getting help for trauma to make sure that you're working with somebody who has experience working with trauma, because bullshit like this can happen if they have no idea what they're doing. Ugh. I do want to say that going through these, there are a lot of therapists in the chat that are probably great ones saying, oh my God, this is horrifying. I'm so sorry that all of you had to deal with this. All right, one more. This one is related to the last one. It says, when they made it about them, I was mid-breakdown, and instead of holding space, they said, yeah, I've gone through worse. Fuck you. That moment taught me something. Not all therapists are trauma-informed, and not all safe spaces are actually safe. Fact. Red flag when you leave session feeling smaller than you came in. Yeah, probably. We need to talk more about emotional safety and nervous system awareness so people can find the right ones. Great point. Just because something has the label of, trauma work, that it's a safe space, therapeutic, what have you. In practice, I really, really wish it was the case that was always true, but it's just not. And yeah, when people kind of go in and they approach it in a very blunt force sort of way with no care for where your body is at, where you are in the process of your, healing psychiatric journey, that's just sad, right? I think that sometimes the work that we do as therapists can be very unempathetic, which is ironic, right? But we need to think about who is on the other side of the chair, or in the other chair, who's on the other side of the screen, where they are in their journey, what they're going through, so we know how to modify our approach. It is not one size fits all. This is really why it's important to, vet your therapists, message them, talk with them, look at their website. If they don't have a website, it could also be a red flag. And if you find that you're not getting along well with them, then switch, right? There's no shame in switching therapists. I know it's not easy because there's waiting lists, insurance, money, all this BS, but nothing is more important than taking good care of your mental health and making sure that you're not entrusting that to somebody who is like one of these jackoffs here. So I hope you enjoyed this. I could have gone for longer. There's a lot of these in the thread. I'll link it in the description, and let me know what else you'd like to see from me.